By the end of this module, you will recognize early warning signs of common mental health disorders, describe behavioral, verbal, and emotional indicators of distress, understand symptom clusters without diagnosing, apply the ALGEE framework when signs are observed, make appropriate referrals in cases of crisis or uncertainty. This module is a cornerstone in mental health awareness education. Its purpose is to equip you with the diagnostic insight and observational acuity needed to identify the early warning signs, symptoms, behavioral patterns, and verbal cues associated with the most prevalent mental health conditions. The emphasis here is not on diagnosing, but on developing the ability to recognize when someone may be experiencing mental distress and respond appropriately using mental health first aid techniques. Understanding the manifestations of mental illness helps break stigma, supports early intervention, and contributes to better outcomes and recovery rates. The diagnostic framework, a non-clinical perspective. While mental health professionals use tools like DSM-5, Diagnostic and Statistical Manual of Mental Disorders, or ICD-11, lay first aiders focus on symptom clusters and behavior changes rather than making formal diagnoses. Key principles include looking for changes from baseline behavior, assessing duration, severity, and impact on functioning, observing risk factors and protective contexts, applying the look, listen, link model of psychological first aid. Common mental health disorders and their presentations, DOA, depression. Symptoms: persistent sadness, loss of interest, pleasure, anhedonia, fatigue, sleep disturbances, feelings of worthlessness, suicidal ideation. Behavioral signs: withdrawal from activities, neglect of hygiene, hopeless comments, changes in eating, sleeping. Emotional red flags: I feel like a burden, there's no point. B. Anxiety disorders. Types: generalized anxiety disorder, GAD, panic disorder, social anxiety, phobias. Symptoms: excessive worry, restlessness, sweating, heart palpitations, avoidance behavior. Behavioral signs: nail biting, pacing, procrastination, avoiding crowds, sudden excuses to leave. Emotional red flags: I can't control my thoughts. I feel like something bad will happen. C. Bipolar disorder. Symptoms: fluctuations between mania, elevated mood, impulsivity, grandiosity, and depression. Manic behavior: rapid speech, decreased need for sleep, high-risk behaviors. Depressive phase: similar to major depression. Red flags: sudden extreme mood changes, inappropriate laughter or anger, delusions of grandeur. D. Psychosis and schizophrenia. Symptoms: hallucinations, seeing, hearing things, delusions, disorganized thinking, flat affect. Behavioral signs: talking to oneself, paranoia, incoherent speech, and social withdrawal. Crisis risk: psychosis may involve disconnection from reality. Emergency support may be required. E. Post-traumatic stress disorder, PTSD. Symptoms: flashbacks, nightmares, hypervigilance, emotional numbing, startle response. Common in trauma survivors, combat veterans, abuse victims. Red flags: reactivity to loud noises, avoidance of reminders, detachment. F. Obsessive compulsive disorder, OCD. Obsessions: intrusive thoughts, e.g., contamination, harm. Compulsions: repetitive actions to reduce anxiety, e.g., hand washing, checking locks. Note: OCD is not being tidy. It's a debilitating condition marked by distress and loss of control. Substance-induced mental disorders: drug alcohol misuse can mimic, exacerbate, or hide other mental health issues. Watch for confusion, disorientation, emotional lability, and denial of use. Functional impact and levels of severity: mild. Symptoms are noticeable but do not significantly impair daily functioning. Moderate. Symptoms interfere with relationships, work, or academics. Severe. Symptoms impair functioning and there may be a risk of harm to self-others. Comorbidity and overlapping symptoms. Depression and anxiety often coexist. PTSD and substance abuse commonly overlap. ADHD in adults may present similarly to bipolar or anxiety. Understanding overlapping symptoms helps avoid misinterpretation and inappropriate reactions. Verbal and behavioral indicators to watch for. Verbal cues: I can't do this anymore. Everyone would be better off without me. I just feel so empty. Behavioral cues: giving away belongings, drastic personality changes, isolation or erratic outbursts. Red flags indicating crisis or emergency. Mention of suicide, death, or self-harm. Psychotic breaks, hearing voices, paranoia. Aggressive behavior toward others. Sudden withdrawal or disappearance. In such cases, immediate referral and safeguarding protocols must be activated. Non-stigmatizing language and respectful observation. Use observational language. I've noticed you seem more withdrawn lately. Avoid labels. Instead of "you're depressed," say, "It seems like you're going through a difficult time." Cultural humility and confidentiality are vital in all conversations.